Hi, my name is Dr. Adewale Adeniran. I am an orthopedic spine surgeon at Texas Back Institute. Today we're going to talk about the spine as it ages. It's important to understand the different components of your spine and what their purpose is. Everybody's spine is organized the same way. It's a series of bones stacked on top of each other, separated by these discs. And if you look in the back of the spine, you'll find that there are joints as well. These tiny joints allow the spine to move. In addition, there's a hole in the middle of your spine that we call the spinal canal. The spinal cord runs down the spinal canal, and at each level, it gives off nerve roots. That's the normal spine. The disc is really important. The disc is important because it separates these bones, which is part of why you have space for the nerves to leave your spine. The disc keeps those bones open. The other thing that it does is it functions as a shock absorber. When you are young and your discs function normally and you bear weight on your body, a lot of that force of your body weight is dissipated through the discs that are through each level. That's really important because it stops your joints, these tiny joints in your back, from being the ones that bear your body weight. That's the normal spine. You've got bones in front. You've got discs in between that act like shock absorbers. You've got joints in the back that let you move your spine. And then you have the main function of the spine, which is to provide support to your body, but also to protect the nerves and the spinal cord. So if you look at this model, you'll see that the part of your spine that's mobile, the part that is permitted to move, basically has three separate divisions. There's the cervical spine, the top part, which is basically your neck. There's the thoracic spine. That's the middle part of your back. That's the part of your spine to which ribs are attached. It doesn't move as much as the neck or the low back, but it also still permits some motion. And then there's the lumbar spine. For most people, the lumbar spine is 5 vertebrae, 5 bones, and it has a broad range of motion. The other thing that your spine does for human beings, and that's really important, is that it has different curves that together line up to keep us upright and facing forward. It helps human beings maintain a level gaze. If you have some issue, which some people will develop and some people are born with, that stops one of these curves, the backwards curve in the low back, the forward curve in the mid back, and the backwards curve in the neck, from being normal, you can develop problems with maintaining a level gaze, forcing you to look down, look too far upright, and causing other issues in your body. Just like the rest of your body, your spine ages over time. And just like any other machine that's ever been devised, it wears out over the course of time. For most people in the spine, the aging process starts with the discs. These are the discs, the shock absorbers of the spine. Because of the nature of the cells that make up these discs, they don't last very long. Usually by age 30, most people will have the early stages of degeneration of their discs. Degeneration of the discs for most people starts in a very regular pattern. It starts with the disc will lose its water content and its ability to act as a shock absorber. Over time, the disc may break into pieces, and that has some consequences. And for other people, over time, the disc will actually collapse. It will lose its height. One of the things that can happen is that as time passes, when the disc is no longer bearing your weight, your joints have to. And when they do, these little small joints carrying all your body weight, they develop arthritis. Arthritis can cause pain on its own, but the other thing that it can cause is arthritic joints get bigger. We call that facet hypertrophy. But when these joints get bigger, when they develop arthritis in your back and they get bigger, they can narrow the space for the nerves on the way out of your spine. That can damage the nerves and cause pain that goes along the pattern of the nerves. That's called radiculitis. They can narrow the space in the middle of your spine, causing something called spinal stenosis. You can have that same process happen at any part of your spine, but most commonly, it develops a clinical consequence in your low back and in the neck. The other thing that can happen in the aging spine, and that's really important and developing more and more awareness of being important, is that the bones can get weaker and weaker over the course of time. the strength of your bones goes down. That's a problem that we call osteoporosis. Osteoporosis has important consequences for your spine because it can contribute to fractures. When the bones get really weak, they just break, and you don't always need to have a lot of force for it to happen. If osteoporotic bones break, they can change the alignment of your spine, they can make you more hunchback, and obviously the fractures themselves can cause pain. Are there people who are more susceptible to osteoporosis? Yes. Women, more than men, experience osteoporosis, especially postmenopausal women. One of the most important interventions that you can undertake as a preventative measure, especially if you're a woman, is to supplement with calcium and vitamin D during a part of your life when your body is still able to make a lot of bone and calcify those bones. Another important, relatively easy intervention is to stay physically fit and active. Weight-bearing exercise helps to build bone. Likewise, strengthening the muscles of your back will prevent stress on your back. Another consequence of the aging spine that goes along with disc degeneration and the loss of the height of your disc is something that spine surgeons refer to as kyphosis. Over the course of time, when your discs degenerate badly enough, there's a tendency for your low back to get straighter and straighter, the consequence of which that you lean more and more forward. Likewise, if you develop osteoporosis and you start to break these bones, they also can cause you to lean more and more forward. This is responsible for something that used to be called a senile fracture. So they used to be called, associated with old age, you'll see very many people will have a hunchback and they lean forward from a combination of having degenerated disc in their low back and inability to maintain the normal straight alignment of their back, and sometimes from fractures, which usually happen up here in the thoracic section, that will lean you forward. This problem can make regular life hard because if you're not able to maintain a level gaze, you have to activate the strong muscles of your legs in order to lean you back so that you can get around. And it consumes a lot of energy and can cause a lot of pain. What are the signs and symptoms of the aging process? In the early process, most people don't have any symptoms. Very many people, everybody, as long as you live long enough, will probably develop aging of your back. That includes disc dehydration, disc degeneration, and all the other things we talked about earlier. And thankfully, most people tolerate it. But for some people, the arthritis can cause pain. For other people, pinching the nerves will cause pain. Shooting pain down your leg is called sciatica. You can have similar type of pain from affecting the nerves in your neck, which can cause arm pain. You can have spinal stenosis. When these joints get bigger and thicker, they reduce the space for the nerves in the center part of your back. That causes a clinical condition that we call neurogenic claudication. This is where people have trouble walking long distances or standing for prolonged periods, because when they do, it squeezes the nerves in their backs even more, and their legs get heavy, weak, or painful, or their back gets more and more painful and they have to sit down. In the neck, that exact same process, reducing the space in the center of the neck, can affect the spinal cord and cause a problem called cervical myelopathy. This problem is more subtle. It damages the spinal cord slowly over time, and some people will develop issues where they start to drop things. They lose the dexterity of their hands, problems with fine movements. That can progress even to the point of feeling almost like paralysis, where people have total weakness in their arms or total weakness in their legs and are unable to function normally. What are the things people can do to reduce the effect on their life of the fact that their spine will age? Well, one easy thing to intervene on is the development of osteoporosis. It's important to maintain your bone health. And so for people who, especially people who are at risk, women, and especially Caucasian women, supplementing with calcium and vitamin D early in life is a very useful thing. Likewise, regular weight-bearing exercise can help build up your bones so that when you get in the normal part of bone loss, maybe you won't lose as much bone to the point where you get to osteoporosis. The other thing I would advise everybody who is due for it is to be screened for osteoporosis. There are images that your primary care doctor can do that can help diagnose osteoporosis, and then there are medical interventions that can help. When it comes to degeneration of the discs, there isn't a surefire way to stop that process. But if your disc degeneration ultimately results in a condition that may require spine surgery, you will be best served arriving at that place in general good health. And so the advice in that case is to maintain your general health as well as you can. Try to avoid the lifestyle things that cause ill health, like smoking and some of the other broad interventions that your primary care doctor can talk to you about, so that if you ever do need something done, you would remain a candidate for a safe spinal procedure. What are the medical treatments for an aging spine? The treatments are really, there's no broad treatment that will stop aging of your spine as far as we know right now. The medical treatments and surgical treatments are really geared to manage some of the consequences of the aging spine. And so if what you've developed is a deformity because of your aging spine, where you're leaned too far forward or something like that, there are surgeries that can help realign your spine as long as you're properly indicated for that. If what you've developed is one of your discs that has dehydrated, a piece of it is broken off and is squeezing one of the nerves, that's called a disc herniation. That can cause symptoms depending on how it affects your nerves. There are non-surgical and surgical treatments for that problem. If what you've developed are fractures of your spine, it's really better to prevent those, but there are non-surgical and surgical treatments for fractures as well. And then probably one of the most common things that's done in the world of spine is treating spinal stenosis, whether in the neck or in the low back. Spinal stenosis increases, it decreases the quality of life for very many people over the age of 60, limiting their ability to stay independent and functioning in their lives. And we do a lot of treatment for that, just because it's so debilitating, and the surgical interventions have been shown to make a significant difference in people's lives. So we can't really stop the aging of the spine, but we can treat the consequences of it, and then you can prepare yourself for the fact that your spine will age by maintaining your good health, trying to maintain your bone quality, and staying as strong and as active as possible. If you are experiencing symptoms, especially symptoms that are related to your nerves, it's a good idea to be evaluated by a spine surgeon. Those symptoms aren't always obvious. For one of the more common conditions, spinal stenosis, the way that it presents is feeling like when you walk longer distances, your legs get painful or heavy and you have to sit down. There's a few things that can cause that, but spinal stenosis is one of them, and it can be missed. Another issue is spinal stenosis in your neck, cervical myelopathy. Very many people have symptoms of cervical myelopathy that they either don't pay attention to or they don't tie to their neck. So they start dropping things where they weren't dropping them before. They lose dexterity, balance. Very frequently we'll get people in clinic who say, I notice when I go to the bathroom at night and I don't have the benefit of light that I have to hang onto the walls because I've lost my mobility. A lot of that comes from spinal cord dysfunction in your neck, and it can be missed. And so if you're having radiating pain down your arm, radiating pain down your leg, or these two other symptoms, those are obvious reasons to see a spine surgeon. Additionally, if you've just been dealing with ongoing pain in your back or neck, you've had lots of medical treatment for it, and you're not sure if there's something more to be done, I'd advise you to at least be evaluated by a reputable spine surgeon. If you're here locally, we'd love to see you at Texas Back Institute.